And this is day 72 of the oil disaster in the Gulf, and there's no relief in sight for the people whose livelihoods have been ripped away from them. For many, the desperation has turned to hopelessness.
Things here in the bayou ain't what they used to be, you know, and just all my friends have been put out of business and stuff. And just their livelihoods, fish and shrimp, oysters, you know, do what we can to supplement our incomes or whatever, you know. And a lot of us, that's our only livelihood.
Yeah, if you have a hurricane, you can clean it up, you know. But this is just like you can clean it up, but it still keeps coming and coming. Hurricane, you can go every day and do something. But the oil, it just keeps coming.
And for some, the cruelty of this disaster just 5 years after Hurricane Katrina was too much to bear. 1 week ago today, the smiling, strapping man in this photo, charter boat captain Alan Cruz, died by suicide aboard his idled vessel. His family says that he became despondent that his beloved fishing grounds were ruined.
He thought it was dead.
Yep.
He said that to you?
Yep.
And that there was no hope that the fishing was ever going to come back?
Not in his lifetime.
Residents say as the outlook of the crisis grows more bleak, the risk of suicides will only go up. In fact, the head of Louisiana's Department of Health and Hospitals wants BP to pay for mental health services for people impacted by the oil spill. CNN senior medical correspondent Elizabeth Cohen joining us now to talk about exactly what they're asking for. And, you know, so far, BP hasn't given them the money that they've asked for.
No, and they say, look, we need to take care of these people. We need to do outreach to these people. We need to take care of them, because if we don't start addressing these problems, you're going to see more suicide, more abuse. We talked earlier to Alan Levine, who's the head of the Louisiana Department of Health and Human Services. Oh, and this is, I'm sorry, I thought this, there exists anger, anxiety, and uncertainty among the families and communities affected by the spill, which will easily manifest itself into addiction and various forms of mental health crisis if not confronted. So in other words, he's saying if without $10 million or at least some money to take care of these people, things are going to get worse. He said already 2,000 people have come for treatment, and you know that money's got to come from somewhere, right, to take care of those people.
Now, when you were in the Gulf, what were you hearing from people? I know you had a chance to talk to various mental health doctors and also the people on the ground.
Right. Levine mentioned anger, anxiety, uncertainty, and all those things are true. What I saw more of was depression. I mean, it's depressing.
Like, what are we going to do?
Exactly. I mean, as you saw, it's a way of life down there. I mean, the fishermen I talked to, they've been fishing all their lives. That was how they made their living. It's how they supported their family. Their fathers were fishermen. Their grandfathers were fishermen. It was not just a way of life. It was part of their identity. It's as if someone said all of a sudden, all right, Karen Elizabeth, you can't be journalists anymore. Right. Can't do it anymore. You love it, and it's gone. Boy, that's depressing.
You're right, and you are constantly thinking about this business, and you always got to have another plan, because it's not something that you'll have the rest of your life. And some of the fishermen with whom I met mentioned that they're just trying to reinvent themselves. They're trying to think of other ways to make money within their environment. One couple that owns a marina, they made all their money off bait. Well, they don't have any fishermen coming in for bait, so what they've done is they're selling supplies for cleanup now. They've turned their whole marina into another type of business.
And I think some people will reinvent themselves like that, there's no question, but some people, it's tough to do, not just the logistics of it, but just emotionally, to say the thing that I have been my whole life, I'm just getting rid of that. Yeah. And I'm going to go on. And that's what I heard, was people saying how depressing it was.
Well, let's talk more about this. We want to take a closer look at the human toll of this oil disaster, from the emotional costs also to the financial. Irwin Redlener is the director of the National Center for Disaster Preparedness at Columbia University. He's also the president of the Children's Health Fund. He's joining us from our New York bureau. And Doctor, I also know Elizabeth has spent time with you as well, asking you the same questions. But right now, what is your biggest concern as we've now witnessed the first documented suicide?
Well, first of all, I agree with everything that Elizabeth said. This is a very dire situation down there, and this has not really gotten enough attention. When we were down there, we saw enormous problems affecting children, and I did a couple of focus groups. One of them was with children ages 9 through 18, and every single kid was expressing serious anxiety, and as Elizabeth said, many depression, because they feel that their way of life is actually now being threatened by the continued assault on their environment. Interestingly, I asked the kids, what's worse, this or Katrina? And every single young person and every single parent that we got to said actually this was worse for them than Katrina was. I said, how could that be? And their answer was, Katrina lasted a day and a half. It wrecked a lot of things, but you can come back in, rebuild, and restart your life. With this particular situation, they're thinking about a permanent dislocation from a way of life and a lifestyle that they absolutely love. And it's round 2 of major trauma. First comes Katrina. The recovery from Katrina is still incomplete, and lots of people still reeling from that. And now we have the oil spill, and in the back of their minds, they're worrying, will there be another hurricane? We're just at the beginning of hurricane season down there. So these families are facing overwhelming threats to their mental health and well-being, and I'm expecting that we'll see lots and lots of kids and their families needing all kinds of support, which they're currently simply not getting.
So doctor, what are you going to be able to do? Because I know during Katrina, you established permanent health care programs for kids and their families, and you dealt with well over 100,000 medical and mental health cases. What can we expect here with regard to numbers, and what are you going to be able to do to try and offer these same people some help, some comfort, some support?
Well, we've already been in touch with officials and colleagues in the government of Louisiana, in the health department there, as well as colleagues at Tulane and LSU. But our intention, as my 2 organizations, the Children's Health Fund and the Mailman School of Public Health, intend to do something very quickly. I think we don't have any time to waste at all, and we need to get in there with services. We'd like to put a couple of mobile pediatric crisis response unit down there. One of the problems is that families repeatedly express the fact that they cannot get reliable information. They're having to make decisions every day on their own. Is it safe for my kids to go outside? Can they go in the ocean? Can they walk around on a beach that's got tar balls on it and so forth? And they feel like there's no place to turn to get reliable information. There's so much confusion and disorganization among government and private agencies and what BP's role is and so forth. So what we'd like to do is sort of get in under the radar there and get some programs established that can really start being responsive to the needs that are really quite acute at the moment.
Dr. Redlener, psychologists tell me, very much along the lines of what you just said, that it's easier for the human brain to handle a disaster that happens like this. It happens and then it's over and you deal with it, rather than something long-term that just keeps going on and on. So what do you tell people, especially children? What do you tell them? Because this isn't ending anytime soon.
That's exactly right. And I think one of the things that's so important is that we're looking at the concept of resiliency. How do you help children, families, and communities be resilient when they're facing a disaster with such uncertainty as this is? And it's really quite unprecedented. And one of the things is to help parents get information that they can use, even if the information is we don't know yet, but we're going to get more information, and have a family plan. In other words, if things get bad and we can't recover our jobs in tourism or fishing or the oil industry and so forth, our plan is we're going to move to another state, we're going to reestablish ourselves. There has to be this constant reassurance that comes from the ability to get quality information that you can use, and secondly, to be able to support your children in particular. There needs to be a kind of a stability, a rock in every family that feels like they have things under control. Even if it's not perfect, we need reliable information, and even if that information has to change tomorrow, we need to have a flow of information that people can count on. Right now, they're dealing in a vacuum of both uncertainty and lack of access to relevant information. So it's rough, but I think we can build resiliency, families can develop a plan, but we really do need to see some money come into the State Health Department and to other agencies so we can be there to support families who need a lot of support during this crisis. And I think the companies involved should really be providing some of that support, and we'll see what happens over the next couple of weeks.
And I encourage our viewers to check out the Children's Health Fund. You're the president of that, and you've done remarkable work. Dr. Irwin, Redlener, thank you so much. Elizabeth, appreciate it. And we also want to tell you how you can help the victims of the oil Gulf disaster. Just go to our website, cnn.com/impact, and there you'll actually find some other links to approved charities that are providing mental health care in the region. Please go there, check out those charities, and also the Children's Health Fund. Dr. Irwin Redlener is the president of that organization.